if we want to jump right into it, just want to thank everybody for tuning in this evening. I know we all have lots of things going on, and this is a pretty important issue, so we appreciate everybody getting together for it. Just to give a little bit of context, the session tonight is going to be going over some high points of the interim guidance for COVID-19 measures for migrant and seasonal farm workers. Maine Mobile Health Program is going to talk some about testing and their services. And we're really going to focus on giving some of the key highlights and leaving lots of time for discussion and questions. So just so you know kind of our approach today. As you guys may know, there was a national CDC guidance that came out that was very long and very thorough about different measures that could be done to help protect farm worker health. We took that, read through that, also looked at what's happening in other parts of the country and Canada, and worked in collaboration with the Department of Health and Human Services, the Maine Mobile Health Program, and ran this through the Maine CDC as well to try and come up with Maine guidance that's a little more specific to some of the things that we see going on, and really trying to emphasize some things that we think, practically speaking, are some of the key interventions. So it's very much aligned with the national CDC guidance, but you'll notice that there's some things that we emphasize more and some things that we don't focus on quite as much as that longer national guidance, but they do go in concert. You may have also seen that there's a short 2-page fact sheet. Again, just trying to hit the high points on that. If people don't have time to dive into the whole big long thing, totally get that. But just trying to reinforce some of these important parts of it. On the call tonight, we've got some knowledgeable folks here who can answer some questions and hopefully clarify anything that there's confusion on. So if you haven't seen me on one of these various sessions on COVID-19 response for different farm groups, I'm Leah Cook. My day job is doing produce safety for farms in Maine with the Maine Department of Agriculture, Conservation, and Forestry. We also have Lisa Tappert. Lisa, I don't know if you want to chime in and introduce yourself.
Yes, I want to. Hi, everyone. I'm Lisa Tappert. I'm the CEO of the Maine Mobile Health Program. And I know many of you on this call, and hopefully we can provide you with detail about our organization and how we can help you and your workers. Yeah, that's it.
And you'll be hearing more from Lisa later on here. Nancy McBrady from the department's on the line. Nancy, if you'd like to chime in.
Hi, good evening, everybody. I'm Nancy McBrady. I'm the Bureau Director of the Bureau of Agriculture, Food, and Rural Resources. Thank you all for being here this evening. I'm very happy to be able to be a part of this team that's worked really hard to put together some comprehensive information that we hope will be of assistance to you all as we enter or have already entered the growing season. And I do also want to thank our partners from the Department of Labor, both US and Maine, and I know Leah will make the introductions in a moment. Just wanted to let you know that our guidance did receive review from the Maine Department of Labor as well. So anyway, looking forward to our conversation, and thanks again for being here. And thank you, Maine, for hosting this.
Yeah, big thank you to Maine for that. Why don't we go to Jorge? Do you want to unmute yourself and introduce yourself?
Hi, big echo. I don't know how that.
Uh-oh.
Maybe we can try again later, Jorge.
Okay. Okay, well, we'll check back in with Jorge. Hopefully we can get rid of the echo. We've got Stephen McKinney on the line. Stephen, would you like to pop up and introduce yourself?
Hi guys, Stephen McKinney here. I'm one of the assistant district directors for Wage and Hour out of Manchester, but we cover Vermont, New Hampshire, and Maine. And mostly I want to be here in case you have any questions about the Family First Coronavirus Response Act. If anybody has, if you end up having any workers, hopefully none of you do, that end up having COVID or different COVID risks and that kind of thing, that might need paid leave or need to be quarantined, that kind of a thing. I'm happy to answer questions about that.
Thanks, Stephen. Jorge, I'm going to let you try and chime in if you'd like to try again. And if it's echoey again, then we'll come back to you when we get into the question period. So why don't you give it a try?
Okay, let's see. No, it's still bad. Yeah, can I just do it in the chat room?
Yeah, why don't we do that? So if you guys want to look in the chat, Jorge is going to drop an introduction over there to everyone. If you don't have it open on the bottom, there'll be that little message bubble, and you can click on that and it'll pop up a field that will have the chat with everybody's comments in there. Okay. All right. So like I said, we're going to try and do some brief, fairly snappy, high-level key points, and then leave lots of time for discussion. So you guys have heard a lot of messaging about the nature of this beast that we're dealing with the COVID-19 virus. But to just re-emphasize a couple of points that really come into play with the approach to this, as you guys know, it's a respiratory illness primarily. There's starting to be a little bit of data that's suggests that it might have some vascular signature as well, of why you're getting some of that blood clotting storms and things like that. But primarily it's respiratory. The main route of infection is you get it through your mucous membranes in your mouth, your nose, and your eyes. We oftentimes don't think about our eyes as a mucous membrane, but there we go. It's one way to get sick with this. The method of, you know what? I forgot to share my PowerPoint. Sorry, guys. Just got right into it. Hold on. Let me back up. Moving too fast. All right. Can everybody see this? Our lovely bogey? Great. All right. So we talked a little bit about the context of the federal guidance and then the Maine guidance. You guys have seen these before, but Donna's dropping the links in the chat as well. So again, newly emerged respiratory illness. We talked about the mucous membranes. The primary route of transmission is through contact. So that can be being within 6 feet of somebody who's infected for 30 minutes or more, sometimes as short as 15 minutes with someone who's infected. And that can be up to 48 hours before they show symptoms. It could also be through being in household contact, meaning living with an infected person. A couple of key points that we're highlighting here are about the incubation period. So after the point at which you are around someone who is infected, there's an incubation period that lasts anywhere between 2 to 14 days. 95% of people who get ill after exposure do so after 14 days. That's why the quarantine is really built to be a 14-day period, because the majority of people who are going to get sick do so by that point. So far, the data is also showing that 50% of people will be sick by 5 days in. So the early period is a really important time to catch this. The infectious period is once you get it, when you can spread it, can last 10 days or more from the point at which you are actually sick, and can start up to 48 hours before you start showing symptoms. So when they do contact tracing, they're really trying to intervene early, because you may have it and be spreading it before you start showing some of these symptoms. That's just a fast run through. There's lots of other things that are interesting that I'm sure will come up, but that's kind of grounding some of our conversation tonight. All right, so we're gonna zoom right into some of the key interventions that we want to focus on from this big, long guidance. Something that's really important is if we can quarantine on arrival for your workers, if possible. We know that some folks will have some challenges with that, but we're gonna open some conversation about ways to do that. Again, that 14-day quarantine is if you have incoming workers, if they're gonna be sick, they are 95% of them will be sick by that 14-day period if they're gonna end up being sick. So that's part of the reason why that's baked into a 14-day quarantine. Another thing to highlight is that pay for workers during the quarantine can be covered by the Family First Coronavirus Response Act. That's something that Stephen can share a little bit more about when we get down into the discussion. But it is important to be upfront with workers that if you're doing a quarantine, who's paying for what? Again, something that we stress in all of this is trying to communicate clearly with the workers, because the workers are worried and want to protect their health as well. And as we all know, if people are not sure about their livelihood, then we don't necessarily have an incentive to do the thing that we need to for the health protection. So I'm moving fast, but quarantine if you can. Point 1. Point 2, talk about testing a little bit. Lisa's going to get into some specifics of testing strategy, but if you are able to test on arrival, That's recommended to do within 72 hours. What you might find happen is you might have a bunch of people who test negative, and you might be able to release them to work sooner than a 14-day quarantine. So a combination of quarantine and testing is like the gold standard. If you can do it, that's great. That's going to be the best strategy, both for public health and for some of your practicalities of getting to work. We know that's not always going to be possible depending on your situation, but we want to talk about that as a method. Testing is available for all migrant and seasonal farm workers. So that's something that was in the June 8th order that came out. So farm workers are part of the essential workers that are included who have access to that testing. It's important for you guys to know. Maine Mobile Health Program can help you talk through what strategy makes sense for your particular situation. Farm workers have multiple methods to get tested for free in the state of Maine. If they have their own insurance, that's great. They can work through that. But if folks are uninsured or they're not documented, there's still a means for them to get the testing and the coverage paid for. So that's something, again, that's baked into the guidance. We have links to different resources there, but that would be something to ask folks about if you have any questions about that. We really don't want fear of a lack of means to prevent people from the testing, which we know is so crucial to find out in a timely manner and prevent it from spreading. And we want people's health to be protected. So if workers have been exposed to someone who's positive for COVID-19 or showing symptoms but doesn't have a test, it's really important to act quickly. As we talked about, that the first couple days are really, really critical. So if in doubt, get in touch with someone and see what you can do, what the best response is. And some of these health partners will help you out in figuring out what that strategy is. Daily health screenings are something that have been widely shared. So daily health screening is not something that you're required to do. It's not something that the state's requiring you to do. It's not something that you have to keep a log for. However, daily health screenings can be a really helpful tool in terms of timely information. So the screening for those symptoms, you see what a bunch of those are. If you don't have access to a thermometer that can take like the forehead temperatures, you can be asking about fevers. Do people feel feverish? But looking for combinations of these different symptoms. So those primary symptoms are the temperature, a cough, shortness of breath or difficulty breathing, some of the new loss of sense of taste or smell. And then you'll also, there are all kinds of other symptoms that show up in different combinations, including the COVID toe and weird rashes, almost anything under the sun. But if there's some doubt about some of those primary symptoms and some other things that are showing up, get in touch with a service provider because they can help out. And Lisa can talk a little bit about that too. They've been helping out with doing some of that screening for folks. In terms of timing for when to do the screening for daily health screenings, as early as you can before folks are being mixed together and put in close proximity to each other is better. So if you can do it before they're getting into any sort of transport, that's going to be a great idea, because then if someone is feverish and is showing symptoms, they're not now going into a bus or a van full of people who are traveling together to a work site and then going to work together. Workers who are showing symptoms of COVID-19 should not be allowed to work, not just for the spread, but for their own health. So that's something to bear in mind. Okay, this is probably one of the biggest vulnerabilities to farm workers and one of our strongest tools to be able to, yeah.
There's a question if the free testing covers seasonal workers on the farm that are not migrant workers. For example, local folks who want to work on the harvest and fall sales.
That is a great question. Nancy, do you want to field that, or Jorge, perhaps?
I don't know the answer to that, so we can certainly look into that, unless Steve or Jorge might know.
I do not know.
Well, I would. Oh.
Would you like me to answer the question for our service, Leah?
Sure. And when I stop talking, I can check that executive order and just see what the language is.
Okay, so the executive order covers seasonal and migrant workers, and our program doesn't differentiate between the two. They're all covered in the same way, as well as any staff that are on the farm. Especially this year, we're trying to be as inclusive as possible about getting folks testing. So yeah.
So it sounds like the answer to your question that Lisa has fact checked better than we have in our homework is that yes, seasonal workers would be included in the testing. Okay, was there another question? I'm not necessarily being able to see it right now.
Go for it.
Okay. So as we talked about at the top, if people are living in the same house with someone who's infected, they're considered to be in household contact, which means they're then going to have to be tested or separated out and have to wait through a period to make sure that they're not going to exhibit symptoms. So as you guys know, when we have migrant and seasonal farm workers, they're very often in shared housing. You guys will know what that looks like on your farm. That can vary a lot from farm to farm. But if we're thinking about that, then one of our most important, that's a vulnerability because everybody's exposed within the house, but it's one of our important tools that we can use to make practical efforts on our farm to protect them. So one of the things that we recommend is if you can group work by those household groups. So if people are living together, can they travel together? Can they work together? Is that something that you can work into your operations? So they have the same risk of exposure throughout their entire day. If you need more people for a given task, can you use blocks of household units that work together consistently so that you essentially have a pod of these two different household units? So we're still minimizing how many people are exposed by not just having it mixed completely, and it enables contact tracing to be a little bit simpler if we do have an outbreak and have to do some sorting out of who is exposed and who is not. So that's something to think about if you can incorporate into your operations this year. That's not to say that people can't socialize. We don't need to put them under house arrest or anything like that. That would be terrible from just a human rights perspective. And also all of us need to have a life. So a way to think about that is household groups need to do the same things that any of us do when we go to the grocery store, we go to gatherings, if they're going to socialize or be close, possibly even work with members of other household groups. That's the time when you need them to maintain the social distancing and they need to be wearing face masks. When we talk about communicating with workers, it would be good to try to share that as well so that they're not feeling like either they're completely confined to a house, to one group of people, and also so they understand the context of when can we not worry about masks. If I'm living with someone all day long and sharing a bathroom and sharing a kitchen and whatever else, I'm in household contact no matter what, right? If someone's positive. But if I'm going to hang out in the yard outside with someone who's not in my household, you know, I'm not necessarily exposed to them if I'm wearing my mask when I'm close and if I'm keeping a little bit of distance. So again, explaining that and being able to do it in a language in a way that people understand can help workers protect their own safety and help you achieve your goals for protecting worker safety as well. So give workers good, understandable information. When we put together our guidance, we did a lot of looking at what was going on in other parts of the US and what's going on in Canada. And something that has come up through a lot of farm worker advocacy groups and just articles of what's been happening other places is that workers want information about how to protect themselves. They're not always getting it. A lot of times folks are worried and uncertain, even about how some of this basic information that we talked about how the virus spreads. Everybody has sources of information. We all know there's the struggle against fake news and conspiracy stuff and whatever. So it's important to try to give just good factual information. And it's important to try to do that in a language that people understand, their own language. So this is something that the Maine Mobile Health Program can help with. They've got speakers who are fluent in Spanish and Haitian Creole. If you have other languages, other types of patois or Canadian French in some cases, we may be able to try to find some resources there to help out. But making an effort to explain that in people's own language is really important. Posting guidance in visual formats as well. There's language-based guidance that you can put up in housing or wherever else, but also remembering to try and do that in visual formats if workers don't have high literacy levels. And there's some materials from the CDC available for that, and there's a couple others kicking around. So if that's something that you need, get in touch and we'll try to connect you with those. But anything that we can do, whatever method we need to try to give them the same information is going to help all of us. And make sure that workers know who to talk to if they have questions or feeling sick. If they can talk to someone in their own language, their primary language, that's important, because sometimes people will say something when they're feeling comfortable with their own language that they might struggle with otherwise. So that can be someone on the farm, it can be someone within the crew, it can also be someone at Maine Mobile Health Program. It might be other people in a hotline that they can call, but give them a point of contact so that they can talk to if they're like, I don't know, I mean, I feel kind of warm, but I'm sneezing, like, is that it? Is that not? Sometimes just having someone to ask and get answers to questions can go a long way towards making people feel like there is a dialogue and they can speak up if there is a problem. Okay, and obviously it's extremely important to act immediately if someone tests positive or has symptoms. As we know, this is an extremely contagious virus. So the faster we act, the faster we can stop it from spreading further. So first and foremost, we want to make sure that workers receive medical care. That's always the primary importance, make sure the person's taken care of. Second, we need to make sure that the workers who are positive, tested positive, or have symptoms are removed from group settings immediately, again, because of the spread. That includes housing, that includes transport, that includes work. And we know there are logistical challenges to some of that, depending on your situation. So again, that's something that we don't want to panic. We want to pick up a phone and call Lisa's group or call us or call Jorge, call whoever you need to, so that we can get the help that you need to figure out where do we put people if you don't have a place to put them. If you do have capacity to do that, then really think through ahead of time, if I have someone or multiple people who are positive and need to be by themselves so that they're not passing this on to someone else and still be safe, where would I do that? How would I do that? There are some hotels who are reserving blocks of rooms, who have conversations with farmers going on. Nancy, I don't know if you're...
Yeah, I can speak to that actually. Yeah, I do know that housing for whether it's quarantine or isolation of a COVID positive worker is a great concern to the broad ag community. And fortunately, there is a program that is mostly, I believe, at least up to 75% funded by Maine Housing, where for isolation purposes, someone with a confirmed case of COVID may be able to be isolated and receive care. So this is a process that will spin up when someone receives a positive test, and if it's made known that housing is needed for them, CDC will be the lead agency that will connect those dots. But specifically, there is a hotel that has been reserved in Bangor. I believe there are 60 rooms available. I don't know the name of it, but there will be food provided, and Penobscot Community Health, if I'm remembering correctly, is going to be the service provider that is going to ensure that social services are provided for those folks who have to be there. And then again, CDC, in working with local partners, will ensure that their healthcare is assessed and monitored, and any intervention that's needed will be taken care of. So it sounds as though there's a very robust backup for those who are going to need to find a safe isolation location for workers who get sick. And I do believe that they are also in contract negotiations with a hotel in Presque Isle. There are other hotels further downstate in southern Maine, but for the purposes of folks who might be down east, I know Bangor is not exactly a quick drive, but it's certainly within reach. And I'm happy to put folks in touch with folks at Maine State Housing for questions, but the real takeaway here is this is a CDC-led effort. It is not something that one can just call up and say, I'd like to reserve a room. on behalf in advance. That's not how it works. It's only if someone within your crew does test positive. At that point, that is going to be reported to CDC anyway. So the process will follow from there. But I think that's really lovely news, that if really someone is ill and needs to be isolated, there is a backup.
Thanks, Nancy. Yeah, I mean, we've definitely seen reports from other parts of the country and Canada where, you know, there's workers who have tested positive who are isolated by shoving the bunk beds over into one corner of the bunkhouse. And clearly that doesn't make anybody feel particularly safe, and really doesn't do anything to stop the potential spread. So again, if you have folks who are positive and need to be isolated, you're going to be in touch with Maine CDC, and they're going to talk through what some of your options are for how to do that. When someone does test positive, you're going to need to coordinate with the Maine CDC to identify people who are in close contact with the infected worker, and then inform those people of their exposure while maintaining patient confidentiality, which can be difficult on small crews, but again, they'll be giving you guidance on that, and doing that contact tracing. So anything that you can do in terms of, you know, the pod style work assignments is going to help with some of that effort. Again, universal testing is recommended for all workers in shared settings. If one worker, forgive my typo, tests positive or shows symptoms, because of that shared exposure, there are cases that we've read where one worker on an entire crew of 56 showed symptoms. When they tested everyone, every single one of them was positive, but the other 55 were asymptomatic. Okay, so because of the contagion and because of the incredibly shared conditions that most migrant and seasonal farm workers are living and working under, the likelihood of spread is so high for this group. It's important to act quickly and try to act universally to try to isolate where that exposure has been. And then you're going to have to report any lab confirmed cases to the Maine CDC directly. And you have to report to the health officers the name and address of any worker known or suspected to have a communicable disease. That's an OSHA requirement that Jorge or Stephen could probably talk a little bit more about than me, but that's part of the deal of what you got to do. Maine Mobile Health Program can help coordinate some of the care, and Lisa will talk about that. And in most cases, Maine CDC and the local health officials are going to help direct your response and when workers can return to work. There's a lot of different scenarios there that I'm sure we'll have questions about. I'm not going to wade into the waters quite yet. So our punchline is close contact equals a really high risk of spread. So you guys have heard me say it over and over again. So give workers good information so they can help protect themselves and be part of the solution. Watch for symptoms. If you can do that daily screening, try. If you can't do it every day, do it as frequently as you can. The sooner we can catch it, the sooner we can stop the spread. Assign work by household groups if you can't spread people out. Act quickly if someone is positive or has symptoms, and work closely with the healthcare providers to plan and respond. And Lisa will share a little bit. Some of this planning with healthcare providers can be done in advance before you have workers there, before you have any sort of testing going on. And a little bit of working through that can help you when you're live in the moment of trying, hopefully no one is, knock on wood. But when you're live in the moment, having had some of those conversations can help you act quickly and decisively and be effective. All right, I'm going to stop my spiel and stop sharing the screen. And I'm going to turn it over to Lisa at this point, unless we have some questions we want to break for right now. It looks like we caught most of the questions in the chat box. So Lisa, why don't you take it away?
Thanks, Leah. Wow, that's a lot of information. So I am going to, I just have a couple of slides, and I think from our standpoint at the Maine Mobile Health Program, we mostly want you to know who we are, because all of the things that Leah's describing are, I think, you know, there's a lot going on, and I just want to first give you my information so that if you have questions, you can always reach out to me or email me. But let me just say a couple of words about who we are. We're a federally qualified health center. So we basically have physicians and nurses on site that can provide medical care. And we provide that care both from mobile units, which some of you have seen parked either at your workers' housing or at your companies. And we also provide care by referral. And so we have what we call a voucher program. And that basically means that even uninsured workers are able to receive care from us and by referral at low or no cost. So that's important, I think, when we're talking about COVID and the possible, everything that could possibly happen, is just to know that our program is basically designed to serve Maine's agricultural workers and to help get them access to care. Many of them, as you know, and as Leah talked about, and as everyone on this call knows, are Spanish speaking, Haitian Creole speaking, other language speaking. And we do have staff on site that can speak all of those languages. In addition to Patois, we actually have staff now that speak Patois. And so your workers may be able to communicate more effectively with some of our staff about concerns that they have. And that's one of the major things that we try to do, is reduce linguistic barriers, cultural barriers to people getting access to care. So like I said, we have primary and preventive care, usually from our mobile units or by referral. And this care is at no cost to the employer. So I'm going to say a few things about COVID-19 testing and how we can help you, and how we've helped some growers and workers already. We are able to come to your camp or your work site if you want us to. And either provide testing to a large group of workers, or we can help you get access to testing by referral. Sorry that I keep moving this, but I want to share a website that is really important for getting access to testing if we're not able to help you, and I'm not able to do that right this moment. Sorry, I'm trying to do too many things at once. But as Leah said, I've talked with a number of you about how to prepare for incoming workers, and I want you to know that we're available to help you very directly on managing sick workers. We're able to do check-ins with folks that are COVID positive who need to be checked in on. We have nurses on staff that can help with that. And I think one of the things too is when Leah was talking about, if there's a positive case, contact CDC. What we've developed is a couple of different step-by-step approaches that say, okay, in this setting, if we're in your camp and there's a person who tests positive, exactly what happens at that moment? Who gets called? How do we call? How do we contact CDC? Are we able to contact them that night? How do we do a quick contact tracing on your farm so that we can immediately say to the staff member, to the worker who's positive, please tell us who your housemates are. We're going to start by testing those housemates. Tell us who you've been eating with, so that we can then find those folks in the camp with your help as well and say, there's been an exposure and we want everybody to get tested. Ideally, if we're able to be in your camp or on your work site, we'll have the capacity to test everybody right then when a positive case is detected. It may be, though, that you have a positive worker and you identify that person and you need testing right away. If you give us a call, we will try everything we can to get a symptomatic person tested immediately, and we'll sort of be on standby while we get the test results back from the referral site, so that we can go into your camp and help you get everybody tested right away. I think Maine CDC is very likely to be using us to do the universal testing once a worker is identified, and we're in really close touch with them. So if that all seems complicated or kind of scary, like we're there to help you in any way that you need. And again, we provide primary and preventive care to workers already, and we're going to continue to do that, and we're adding this to our sort of scope of services. So if you need help, we're here, and you can absolutely call me and I'll talk through how you can get testing. We do have a smallish team, We're pretty booked right now for blueberry workers testing from basically July 25th through August 6th. We're testing about 50 workers a day during that period of time. But if you are interested in testing, please let me know as soon as you can, and we'll see how we can help you. And I'll share the website that gives you, if you click on it and put in your zip code, it will show you what testing sites are available close to you and what is needed for a test. So even if we're not able to provide testing and you go to a testing site, we can also, you can call them. If they say, well, no, we can't test you if you're asymptomatic, we can send a doctor's order in to get you and your crew or your family or whoever it is tested. And yeah, and so we're here to serve migrant and seasonal farm workers and everybody who's working on the farm this year to keep everybody safe. I think that's all I have to say.
Lisa, did you want to take a couple minutes just to talk about quarantine and testing strategy for that initial arrival period?
Yeah, I think I would kind of echo what you said, Leah, that it's, you know, the gold standard from the CDC's perspective and from the public health perspective is to, you know, keep people together who arrive together to prevent any spread if any of them are sick to the outside communities. But ideally, if you're trying to keep your workers as safe as possible and you're doing quarantine, you do want to quarantine them in smaller groups so that if one person tests positive, then you have a smaller group that is potentially exposed. That's the gold standard from CDC because, as Leah said, after 14 days, it's very unlikely, if nobody shows any symptoms, it's very unlikely that anyone's contagious with COVID or has it. The on-site testing, you know, within 72 hours or the testing within 72 hours is as good as the testing is nowadays. If you get a positive test with any of the tests that are available at this time, you can be rest assured that it's positive. If you get a negative test, you still want to take precautions and keep people with using masks and doing social distancing because the false negative rates exist. And, you know, there isn't one rate right now that we could point to and say, this is the percentage of false negatives because a lot of it depends on the way you collected the sample. But it is a strategy that a lot of growers who can't really afford to have their workers quarantined for 2 weeks are interested in. And so we've been very lucky to receive from the state CDC lab testing platforms and kits to provide rapid testing, which gives you a test result in about 15 minutes per person. Is that what you were after?
Yeah, with my nefarious agenda. Yeah, that's great. That's good information. Stephen, I noticed you're unmute. Did you want to add anything about the family first part of it and funding for some of that?
Yeah, definitely. So, you know, the Family First Coronavirus, that law requires that you provide leave to employees, but it's supposed to be very helpful both to the farmer and the workers, because obviously if you end up with some workers who have COVID-19 exposure or have COVID-19 itself, what the law does, it provides 2 weeks of paid leave to the worker when they're unable to work in a situation where you have work available and they're unable to work because of COVID-19. And but the program, when they passed the law, they also passed a reimbursement. So what happens is you know, if that situation comes up, let's say somebody does have COVID and they're seeking diagnosis, or their medical provider tells them, hey, you need to self-quarantine so you don't infect other people, that sort of thing. There's a number of triggers, but you know, we're going to keep it short here. So if there's such a trigger that they're unable to work because of COVID-19, one of the reasons listed on our poster, and if you don't have the poster, you want to get it and get it up so workers know, and it's also a good guide for you to see what are the reasons why this leave could kick in. And then there's a reimbursement program for it. So you would pay that employee on your payroll, even though they're not working, they're quarantined. And then it's a payroll tax reimbursement. And I can't say a lot about the process. It's on the IRS website. There's a form you use there. There's a whole series of guidance on irs.gov about it. There's Q&As, and there's a specific form you use on the website. But if you look for guidance of under COVID-19 on the IRS website, it'll tell you how to get that reimbursement. It's a payroll tax reimbursement. So it can be really beneficial, both number one to your employee who is sick, who you get to take care of them and pay for their leave, to your other employees so you don't affect them, but also then to you because the ultimate expense is not borne by your farm, it's going to be borne through that tax reimbursement. So, and if you end up having questions, the best place to go about the requirements are our website, dol.gov/WHD. So that stands for Wage and Hour Division, dol.gov/WHD. And you'll see COVID-19 in the workplace. It's one of the first things that pops up, all kinds of information, Q&As, posters. There's a number on the poster you can call for info. And then for the tax reimbursement, irs.gov, and you'll follow the COVID-19 links.
Great, thanks, Stephen. Oh, go ahead.
Yeah, could we jump in with a question, Leah?
Yeah, go for it.
This is Nicholas and Ruth from Blue Hill Berry Company. And that's, Stephen, that's really a big question for us. One is we're already organized so that our crew will be tested on day one. The day they arrive, they're gonna be tested. So technically we've hired them, but should we expect if someone tests positive on that day that we should be paying them and not fire them? Because there may be legal ramifications.
Correct. So there's no eligibility timeline for the 2 weeks of paid leave. In other words, once you've hired somebody, that very same day they become eligible. There's some other aspects of the law that I'm not going to talk about with childcare, where there is a certain timeline before people get the leave. But in this case, once you've hired somebody, and then let's say they show up the first day and they start working, and they test positive, they're immediately entitled to the leave. And again, that may sound burdensome, but on the other hand, it would be reimbursable for you. The other thing I forgot to mention, just because I know it causes a lot of confusion, there is a small business exemption, but it does not exempt you from this 2 weeks of paid leave for if somebody has COVID or somebody has to be self-quarantined for COVID. The exemption only relates to childcare issues. And I'm not going to go into all the details of it, but that's a very important distinction because some people hear small business exemption, and I imagine many farms in Maine are small, but the definition of small is under 50 employees. But the exemption does not exempt you from this 2 weeks of paid leave if the person is unable to work because they have COVID or because they need to self-quarantine due to COVID risk either. Okay, so there is no exemption, but again, there is reimbursement.
All right. I'm just a little worried because, to be paying them weekly while they're sick and not be reimbursed till it sounds like you'd get that reimbursement when you file your quarterly employer tax form. Is that what you said? Okay.
That sounds accurate to me, but again, that's the IRS. There may be, I believe there may be some kind of way to get that a little bit sooner, but I'm not sure that you would have to go straight to the IRS in terms of the timing of that reimbursement. But in terms of the leave, yeah, it's up to 2 weeks of payroll that you would have to run that would be reimbursed. And it's only 2 weeks. If the person's sick longer than that, there's no obligation to continue to pay because you won't be reimbursed beyond that either.
Right. Okay. Thanks. That helps clarify some.
Good.
Okay, does anybody want to jump in with some questions?
Yeah. Go ahead. I unmuted you.
Ed Bozanowski from Row Orchards. Somebody comes down with the virus. I have 6 employees, and I picked 35,000 bushels with 6 employees. Now you take them out for 2 weeks. Do I get a new worker? I'm not allowed to get a new one until he goes back to Jamaica.
Yeah, Ed, is this H2A workers?
Yes.
Okay, Jorge, do you want to try? I'm not sure if you're the right person for this, but do you want to try the echo machine?
Yeah, hi. I'm speaking into the telephone. I'll unmute.
No mics.
Jorge, I think you have to close your computer.
Because Ed, I'm glad you asked that question because that's the elephant in the room, right? Like that's our big boogeyman.
How do I get my harvest done if all my guys get COVID and And I'm
Exactly.
paying them for 2 weeks and I need 6 new guys.
Right,
And you can't get
And I
them.
can't have them until I send those back.
right. Hoping we get Jorge on the line.
Well, he's been really good to us in the past, so he'll get back to me.
That's good. While we're waiting for him to chime in, I think it's important to know that some sending countries are making the workers sign waivers before they leave, acknowledging that they're at higher risk of exposure of traveling right now, and then making them sign that the government of the sending country takes no responsibility for repatriation, either of their wages owed or of their personal effects. If they get sick and die, they're saying they're not going to help. So just to bear in mind that this is what some workers are coming to America with, like the context that they're coming from. Well, now it looks like we lost Jorge altogether. Maybe he's going to call in. Nancy, do you know any answer to the question about what happens? Can we get more workers if our workers are sidelined?
That is definitely outside of the scope of my knowledge. I am wondering, did you mention your name was Ed? Did I hear that correctly?
Yes.
Okay. Is there any flexibility in your time frame for what? No.
There isn't. We've got 8 weeks to get the apples picked.
Yeah.
I might have a day.
Right. Right.
So if I lose, a guy for 14 days, probably going to lose them all if somebody's come down.
Well, there is that sort of sticky wicket that if they test positive but they're asymptomatic, and we do have mention in our guidance, and this is where I'll turn it back to Leah and Lisa because they're quite fresh on it. But if someone is asymptomatic and has tested positive, there could be a potential for that person to work. It's not ideal, but that's only in the case where they're asymptomatic. I understand that you're also preparing for the worst, that these people might truly be ill and need to isolate and not be in any condition to work. So I don't know if you want to take that up, the asymptomatic nut, or if Jorge's on, maybe he can jump in about H2A details.
Yeah, I mean, Lisa's raring to go on this one. I mean, before Lisa gets going, I would say that, so the CDC guidance for if there's exposure in the workforce came out at a time when testing was not easily available across the country. So what that says is if you have a worker that tests positive and your other workers are exposed, if you do a health screening for them, this is without testing, and they do not have symptoms, they can return to work. You need to do daily health screenings and continue to monitor for symptoms. They need to wear face masks at all time while working.
Hi, this is Jorge.
Hi, Jorge. Give us.
Sorry for the
Yeah,
technical
no,
and sorry for interrupting.
that's okay. Give me about 30 seconds, and then I'll let you jump on the
Okay.
H2A question. Okay. So the previous CDC guidance said that if your workers are asymptomatic after exposure, they can return to work. If you're monitoring for symptoms, anybody who develops symptoms needs to be put out of the workforce. They need to wear masks at all time while they're working. You need to use social distancing. And after that initial exposure of someone who's been confirmed positive, you would need to disinfect the areas where they were working. So beyond cleaning and sanitizing and into disinfecting. Like I said, this came out at a time when testing was not widely available. So we may jump back to Lisa after Jorge can answer your question about the H2A replacement workers, because now we do have testing readily available. So some of that strategy might change. But at the federal level, that is what the CDC guidance said and still says as of the last time that I checked it. So I will pause there. Jorge, would you like to chime in on Ed's question about if all of his workers get sidelined, can he get more workers on what time frame? How does that work?
Well, that's a very good question, and I think that it really should be addressed with the New England Apple Council, and I will certainly ask the federal office, the Office of Foreign Labor Certification, in terms of what the process would be, and also the Immigration Services H2A, in which the workers would be transferred. Now, ideally, the situation is that if workers are from the initial days 3 months ago, almost 4 months ago, is that if an H2A worker is deemed positive and is under quarantine, that the responsibility is to take care of that person under that situation. And I realize that that seems ominous, because if the whole crew gets sick and you only have 6 and they're all quarantined, then you have a crop that needs to be picked. This needs to be addressed at a couple of different levels, as I mentioned, the New England Apple Council for one thing, and in conversation with the Jamaican Labor Board, but also the Foreign Labor Certification Office and the Visa Processing Center, in terms of allowing the workers that you have in the country already to return home safely. And that's the other question too, is whether the Jamaican Labor Board would assist in re-entering those workers into Jamaica if they were tested positive in the United States. So it's a very good and important question, and I'll certainly look into it beginning first thing in the morning. And but I also encourage to please contact the New England Apple Council in terms of being your agent, as to how you could maybe transfer other workers to you that are experienced in efficient apple harvest.
Thank you.
Okay, we'll be in touch.
It does sound like there's a time lag that would be great to know more about for everybody on the call, probably. Because that's not my field of work, but that sounds like a lot of chain of command to try to get replacement workers, even assuming that, Ed is taking care of the 6 workers while they're quarantined, but that's still 2 weeks of harvest that needs to happen in a short time period with a perishable crop. So right. I think we're all interested in what you find out, Jorge.
Yep, we'll see what happens.
Yeah, great.
Hey, Jorge, this is Eric with the Wild Blueberry Commission. Just to second what Leah said, I'm definitely interested in the answer to that question too. So if you could loop me in at least, that would be very much appreciated. Thanks.
Okay. All right. Very good.
Steve, I had a question. I'm on your website right now. And I was wondering if any of these posters are mandatory to be posted, or all of them are? Yeah.
There is one that is mandatory in terms of the Family First Coronavirus Response Act. And it's the one that at the top says employee rights for paid sick leave. So if you don't have a poster up that says employee rights for paid sick leave at the very top, then you need to get that up as long as you have less than 500 employees, which is probably all the farms on this call. So definitely be aware of that. And it's just the poster that explains what we've talked about with the Family First Coronavirus Response Act and the 2 weeks of paid leave. It gives the reasons why leave, gives the caps of the maximum amounts of time and pay that could be. And it gives a phone number that you guys can call for more information too. So, but yeah, thanks, Jason. That is mandatory.
Yeah, thanks for dropping that link in the chat, Jason. So if you look in the chat box, there's a link to the mandatory poster to be posted. Do we have other questions from folks who want to unmute themselves? We had some questions on a previous call this week about what do you do if you have workers who don't want to wear a face mask, if you're requiring that? I think there's a lot of de-escalation techniques that we can use. So folks who are saying, well, I have a condition and I can't breathe through a mask. Now, we all know in field work, there are situations where we need to be concerned about heat exhaustion and staying hydrated and all of these things. So, we're not diminishing that at all. But folks who are, when you're saying, I need you to wear a mask in these particular situations, and their first response before even trying it is, I have a condition where I can't do that. You know, one of the things we talked about is asking them to bring you something from their doctor. Another thing that we talked about is that, you know, someone who, for medical reasons, has trouble breathing through a mask might not want to be out and about in a respiratory pandemic. That's sort of like a common sense point. But Nancy, I don't know if you wanted to chime in at all about what some responses may be in terms of requirements to wear face masks, or potentially Jorge or Stephen, where this is something that as a business, the business may be requiring it, whether or not it's required by executive order, and then what options are there, and what repercussions may there be if someone says, like, you can't fire me for not wearing a mask or whatever else. Anybody on the labor side want to speak to that?
That is definitely a labor question, and it's not something that I'm comfortable trying to dust off my JD for. That was not my area of practice. And I don't mean to make light of it. That's actually an incredibly important and difficult discussion to have. You know, to Leah's point, the mask wearing, especially under the executive order, is where people cannot be physically distanced by 6 feet. So when you're out in the field working, you know, there are going to likely be instances where that mask just needs to be in someone's back pocket, and it needs to go back on when they're getting close to their fellow workers at a break, or other instances to that extent. So it is not meant to be glued on someone's face at all times. And there, you know, under the law, for people to say, I have a medical condition, I can't be wearing this, are there accommodations that can be made, right? And they have to be reasonable accommodations. But all right, should that person then go into the room after everyone has left? Does there need to be rotation or you know, scheduling such that that person is not wearing a mask but is not within 6 feet of people? So those are reasonable things under the law. Just because someone says you have to accommodate me does not mean it has to be anything but a reasonable accommodation.
That's a good answer.
This is Jorge. Yes, definitely reasonable accommodation is very important, and I think that you know, an initial way of figuring out how to have a conversation that resolves any kind of a tension is very important. However, the employer has the prerogative to set work rules on their work site, and for example, under H2A, several employers have you know, very extensive work rule requirements of behavior and expectations, and et cetera, et cetera. And based on those, they can receive, the worker can receive warnings, they can receive reprimand of some sort, and then be fired. Now, the rule across the state of Maine, regardless of whether it's agricultural or not, is it's a right to work state, and employers have the right to hire and fire at will. So that's, you know, that's the kind of the buck stops here situation. And it's unfortunate if a worker really needs that job, especially if they're a local seasonal worker that just needs that kind of work, and obviously they're there because they need work. And so it's really important to figure out a way to work around and work with that person. But again, the employer's work site, work rules and expectations are the employer's right on site.
Great, thank you, Jorge. Jason, did you want to add something?
Just to me, it seems in the same category as Jorge was saying, as requiring steel-toe boots or that you wear hearing protection when you do certain tasks, things like that. So I definitely am not that familiar with labor laws, so that's just.
Yeah, there is no constitutional right to not wear a mask, just for everyone's edification. There was a great question in the chat room about face shields, and I'm assuming that a face shield falls within the category of a face mask, but I bring that out to the group to weigh in on. I could be incorrect there.
When we say it falls into the same category, I guess the question about what about face shields is which aspect of that are we talking about? Are we talking about like a worker employer requirement to wear them, or when do we wear a face shield versus a mask, etc.? Do you want to speak to that a little, Donna?
Well, I just wondered, I've heard it battered around. Sometimes it's, we hear that face masks are required, then we'll hear face covering is required. And then we see that there are some people that use face shields instead of a mask. You know, in some of the stores, some of the workers are doing that. And it's like, if there's someone who, for whatever reason, can't wear a cloth mask over their mouth and nose, could they may be able to wear a shield, and would they be in compliance?
Okay, I'm gonna let Lisa speak a little bit to purposes. Do you wanna do that, Lisa? The purpose of a face mask versus a shield, and what they.
Yeah, I think what we're trying to do here from the engineering standpoint is prevent droplets from escaping my mouth and nose and travel to your mouth and nose and eyes. And a face shield, because it has this opening underneath, a face shield without a mask underneath it is not the same protection as a mask that covers your mouth and nose. Masks can have a lot of different ability to trap those droplets, depending on how they're constructed and what type of mask they are. But we don't, in our practice, have face shields being used as a substitute for anything. We have them as an addition to go on top of another kind of mask. It's really insufficient by itself to do what you're trying to do, because the droplets are coming out from the bottom. Even if they're not hitting you here, your droplets are coming out from the bottom and going into the air. That's the scientific explanation.
So as you guys have been saying, there's a couple layers of this. So the wearing the face mask is not just for like we're sneezing or coughing and we're expelling a lot of droplets that are larger in size. It's also for those smaller ones that we normally are exhaling when we're talking or talking loudly or singing or laughing. That all increases the amount of those respiratory droplets that we're sending out to everybody around us. So you guys can think about your farm context and think about how often is someone raising their voice to joke or laugh around. I mean, I grew up on a farm, and me and my 4 siblings would all sing different songs at the top of our lungs. So this is something like, that's one of the purposes why we wear a mask, is mostly to keep our stuff to ourselves, but also for some layer of keeping other people's stuff from getting to us. And then that shield is an extra layer for like the real splash zone. It can also be worn in cases where those masks are in low supply, and so people are trying to extend the life of that face mask. So they do that partly to keep the brunt of it off of it, so that then the sanitizing can be more effective. We've had some discussions about things like the face shields and plexiglass, pieces of plexiglass you may have seen in like the grocery stores and situations like that. That's just like a salad bar and having the sneeze guard, right? That's like for face to face. Let's keep those blunt force spray zone from getting at each other. And that is kind of an appropriate use for where we would want that. When we start looking at equipment lines or anything like that, where we're standing side to side, well, unless I'm turning to sneeze at you or cough at you, you know, like what is it doing in terms of what we're breathing out into the air? And the latest stuff that's been coming out has been supporting some of this aerosol. Even in our normal breathing, talking, whatever, we have these suspended particles that are in the air. It's not just about me spitting on you or sneezing or coughing or anything like that. So again, you know, if you are working across a line from each other, that might be a good time to have some sort of plastic barrier at that point, whether it's a face shield or you're hanging something. We've talked a little bit about if you're going to hang a plastic shield near your equipment, think about how are you cleaning it? Where is it draining onto? If you are cleaning it, are we creating food safety hazards at that point from chemicals or anything else? So just some context to think through. All right, let's see what this comment is. Yeah, allowing people to get breaks from wearing masks as they get hot and uncomfortable. So a chance to walk away and take off the mask and get a break. I think that's great. I think all of us who have had to practice wearing them know that after a while you get kind of stuffy in there. And again, you know, face masks, we want to be wearing it when we can't maintain the social distancing, because that prevents even those of us within the same household from having that increased risk of exposure. But again, when we come to contact tracing, like I've been on lots of farms where you can't work 6 feet apart. You know, we're following a harvester and we got to be shoulder to shoulder to cut whatever it is and throw it up on, you know, the harvesting rig. And so in those cases, you know, yeah, wearing face masks will help protect us from each other. But again, if you can group people by their household, you have a little bit more protection in terms of what that shared exposure is. So that household unit is not like a fail-safe, but it is a way to reduce the risk and give us a little more breathing room, pun intended, you know, that there is a little bit more room there if we're living together and, you know, we're around each other all the time. As much as that may be annoying socially, it does tend to lower our risk and give us a little bit more safety when it comes to, you know, what's the risk of someone not wearing their mask if they're working together or not wearing it in the van. So thanks for that. That was a great point. Anyone else have some questions or want to chime in? We're prepared to hang out and just field any questions that you got and try and hunt down some answers for you. So go for it.
Hi.
Hi.
Dory here. This all sounds a bit overwhelming. So we have 6 folks coming. Should we have an issue, the first call I need to make would be to Maine Mobile Health if we're concerned about. Would you agree with that statement? That would be the first call.
Lisa, you want to raise your hand? You're on mute.
Yes, we always want to be the first call. It depends on what you're trying to do. If you're trying to schedule testing, we would be happy to advise you about that. There are other folks to call if you're concerned. You know, I think there are others on this call that might be also your first call. But if you're looking for testing and you need some advice about how to set things up, we can help, and we can also refer you to other folks that can help.
And Lisa, if someone's getting sick, are you the first call for Dory?
I think so. We would like to be, because we do have a pretty direct line into Maine CDC, and we can mobilize people quickly, and our medical director will be right there with you.
Okay, well, I will give you a call because I do want to get something set up for testing as soon as possible when they arrive, but they're not coming until September.
The sooner any of you call me, the sooner I put you in our calendar and schedule you for testing. But it's kind of a first come, first served basis. And I just want to reiterate, though, you know, you don't have to test your incoming workers. The quarantine is available. But yeah, we know about you first. We'll put you in the schedule first.
Okay, sounds good. Thank you.
Yvette, did you want to talk a little bit about the Maine farm labor link?
The Maine farm labor link.
Mm-hmm.
Hi, are you there?
Yeah, thanks, Yvette.
Yeah, no problem. Yep, my name's Yvette Minier. I work for the Maine Department of Agriculture, Conservation, and Forestry. And one of my jobs is the Farm Labor Link Network Coordinator. It's a group of state agencies and service providers that try and connect aspiring and also current agricultural professionals find resources that they need for anything related to labor, human resources. I have a website with lots of information, including some of these posters we've spoken about, and resources for Maine Mobile Health, migrant workers, and we're undertaking a labor campaign awareness, an ag labor awareness campaign right now. So we are, promoting Maine Job Link, where, if you've had an H-2A worker, you would have had to post your job through there. And so we're really promoting folks looking for work, and also employers posting their jobs there to try and connect folks to look into agriculture.
Thanks, Yvette.
Yeah.
Can I say one more thing, Leah?
Yeah.
So our organization, along with Jorge's division at the Department of Labor and a number of other organizations, are part of a group called the Farmworker Resource Network. And I want to say that a lot of the things that I've heard today that people are concerned about might require a couple of different groups collaborating together to solve problems. And we're really used to doing that. We have a very long experience with this group that focuses on education and emergency assistance and labor and health. And I just, again, want to say that you're not alone. And we have many times been asked for things that seem kind of unusual. Like, we're sort of a program that I think can fill some of the gaps that you might find for your workers. So, in the past, we've had requests for people to immediately return back to their home countries for one reason or another, or a request to repatriate remains. And, so I just want you to know that this group is here for you and for your workers, and we can help you with unusual requests too. So.
And thank goodness. Thank goodness. Just say that.
This is Jorge. I just want to follow up on Lisa's comment, so that everyone should just feel free either to contact me or to Lisa. And we collaborate in a way that we have a referral process and an actual referral form. But just even verbal communication referrals are very efficient, so that if someone contacts Lisa and says, oh, we have an issue with a social issue that Maine Mobile Health can't address, or a labor issue that Maine Mobile Health, Lisa can refer you to me, and vice versa. You call me and you have some question about some assistance because the worker's car broke down, or that they need transportation to a medical pickup or something like that. I would then refer them to the agency that can help you, which would be one of our partners within our Farmworker Resource Network, which includes a variety of either state, federally connected programs, state agencies, and nonprofits that serve migrant and seasonal farm workers. So again, we're all linked together. We've all been working together. We've operated the very famous and well-known nationally Raker Center in the Down East area for the blueberry rakers for now come up to 20 years, and provided services to the apple growers and the vegetable growers all through and all that. So, and I know there's a small group of actual farmers on the line, and many of you know one or both of us or the other programs. So please pass that on. Thank you.
Thanks, Jorge.
I'd just jump in on that to voice appreciation. I think I talked to Lisa a week or two ago and said that it's kind of sad that it took a worldwide pandemic for me to become aware of all these networks and these support services, but I'm so glad that it's amazing the work that a lot of you service providers are doing. And I'd also then just jump in that I recently myself became an ag service provider working for MOFGA. And in reply to, I think, Ed's question about labor, I would actually even throw it out to, you know, people like Donna Kaufman and Jason Lilly or myself. We have a lot of contact as ag service providers with what's going on with other farmers. And there's a lot of email listservs where farmers are saying, hey, you know, I know this worker who's looking for work, things like that. I also use some websites for migrant, or I'd say seasonal farm workers within the country, things like Good Food Jobs or the ATRA website has internships. So a lot of us ag service providers also may help jump in if there's a crisis where you need 6 workers to help finish your crop. There's a lot of interweaving and network support amongst a lot of the ag service providers in Maine. And it's just so wonderful to see, especially during this time of crisis.
Well, and this sort of rapid labor response might be something that could come out of that too. So early on in the pandemic, you guys may have seen that Vermont went ahead and started developing a list of people who were experienced dairy operators in case there was a dairy that lost workers and needed someone immediately, like you guys, very timely. And I don't know how much they ended up needing to use that, but that may be something that we can look into with some of the ag service providers on this call, or even just within the community, just the ag community, to say, all right, well, we know we've got some crunch seasons coming up, right? Like broccoli's getting cranking, blueberries are about to start. We kind of know when the apples are going to hit. And depending on where things are at with the pandemic, that may be something where we can sort of be in some conversation, so we have a little more readiness that if we do have 6 people go down up in Newport, you know, we might be able to say, all right, well, we might be able to bring this many people from here who have experience. So I know I'm an eternal optimist, but we may have some options to do there with a little bit of pre-gaming.
I think the key is if something happens, get the word out quick. And the whole state can help you instead of just trying to do it yourself.
Yeah, that has certainly been a lesson here for the Department of Agriculture in the last 3 to 4 months. Even within our own departments, being able to pick up the phone and call someone at DHHS or elsewhere, making these connections has been really illuminating. And we do hope that this guidance, you know, is a demonstration of that we're trying to be more tethered and be more alert to the resources that are here. The example of being able to get that Maine State Housing program to be expanded for migrant workers for quarantine, for isolation purposes is an example of that. So we certainly appreciate every one of you being a part of this tonight. It's a lot to distill, and we're certainly available for follow-up questions. You have our contact information. I hope you have Lisa on speed dial. And we're happy to continue this conversation. And I just want to wish everyone the best of luck. I know that these are really hard times, but you're doing the right thing by paying attention to this and trying to put your best foot forward.
This is Yvette again, if I could jump in.
Mm-hmm.
In the chat, I went ahead and put down the website for the Farm Labor Link Network, and folks can sign up for emails where I would share, you know, tonight's meeting and other labor associated events and, you know, other press releases for resources. And then I also shared with you guys the Ag Labor Awareness Campaign information if you'd like to peruse that and join the campaign. We can help you, you know, promote your opportunities.
And a reminder, if folks want to save the chat instead of feverishly trying to write down all those web addresses, when you have the chat box open, way over at the bottom on the right, there are 3 dots. And if you click on the 3 dots, there's the option to save chat.
And that'll give you a file with all the links and all the comments.
Well, thank you, Leah. This is Jorge. Thank you for the opportunity to participate and listen in. And folks can reach me. Many know how to contact me, but otherwise, my information is easily available. And please pass it on if someone doesn't know where I am or who I am. Thanks very much for putting this on. Appreciate it. I'm going to sign off now.
Okay, thanks for joining us, Jorge.
Sure, my pleasure. Good night, everyone.
Night.
All right, well, I guess I'm gonna say if there aren't more questions, we can go ahead and wrap this up. I would just let you guys know, hopefully you've already seen this, that during this pandemic, the department is just trying to scramble to meet whatever needs there are. So I would say no matter who your contact is with the department, throw them the question that you have. You can ask me questions and I'll run it up the chain to whoever the right person is to answer it. And most of us are trying to do the same thing no matter where we are within the overall system. I think Lisa and Jorge sound like they're a great Ghostbusters dispatch here for all kinds of interrelated questions we might have about our migrant and seasonal farm labor. And I just want to thank all of you guys for joining in, because this is one of the big issues that's kept me up at night, and probably you guys more so than me. So I just appreciate everybody taking it seriously and trying to find out more information. And I want to thank Stephen McKinney for joining us from the U.S. Department of Labor and lending some insight into stuff that's beyond most of our expertise. And Lisa for giving us her expertise and all the work that she does out in the field. Donna and Jason from the Cooperative Extension, who have graciously hosted for us and joined us on so many of these and gotten the word out. And Nancy for letting us put the manpower on this and joining in on this and really putting department resources to work to try to answer the needs of the moment. So thank you all, and holler at me if you need something.
Hey, Leah, this is Eric with the Wild Blueberry Commission, and particularly relevant, I think, because this call was so very valuable. Thank you all. This was some really great information. Where can I find this recording to share with my growers?
What I can do is I have an email group that I sent the invite to that attended the weekly farmer Zoom meetings. If you were on that email group, you'll get it. If not, you can put your email in the chat and I can send you a link to the recording once it's done its thing. It takes a little bit of time for it to get settled in.
All right, so anybody who wants to get this recording directly emailed to them, drop your email into the chat box and Donna will send that when they get it updated. It does take a little bit of time just because they have to make it accessible to all and process that recording.